computer. Well, hello. We have a special guest today, and Amanda and I are so excited because it's not us talking the whole time. This is Jen, and she is on a mission to take down the health industry. Is that a good summary of it?
I love it. Yes, I'm using that.
So tell us how you're going to take down the health industry. Tell us
Let's
about
talk
you.
about it. Yeah. Well,
Yeah.
we want to make sure people stay healthy. So we don't want to take down the access to healthcare. We definitely want to take that
Right.
down. So first of all, I just want to say thank you so much for inviting me on. I know that you're committed to making a really big difference with the people that you work with and people in your community. So I'm excited to just be a part of this conversation, and I'm excited about what you two ladies are committed to and up to in business. So thank you, firstly. But yes, my name is Jen Olsen, and greetings from the nation. Well, I guess the US's capital, if you're in the United States. And yes, I am committed. I love how you said it just in our conversation, Jenny. You're like, take down the health insurance industry. And I say, yes, I am here to disrupt and to take down the health insurance industry. I just think that so many people don't know that there's other options. They've been in like really bad relationship with the health insurance industry and only think they can get it in certain ways. So I'm here to disrupt what people think is possible and to offer them another solution. And there is a place for the health insurance industry. I don't want to completely disrupt it. There are reasons why people can and should stay on health insurance, but there's also, I would say, 75% of the time we're a really good solution for people to not have to like literally give like an arm and a leg and go between, do I feed my family, pay for this, or do I get health care, all of those things. So we really come in to alleviate that and let people know that there is a difference out there. So yes, I agree with what you said, and that's what I'm out to do.
And that's wonderful because I know health insurance is a big cost to people. I mean, it's a big strain on the budget, the plan, the money, however you want to phrase it.
My gosh, I know people who have paid more for their health insurance than people pay for their mortgages.
That's crazy. I can't wow.
It is so crazy. I mean, I've heard of people, a family of three, paying almost $2,500 a month. They're healthy, they go to the doctor like twice a year, if that. And I'm like, $2,500 a month. It's out of this world. It's crazy. Yeah, we all know that it needs to be disrupted, right? Like, we could agree on that front for sure. Yeah, definitely.
That's so cool. I'd love to know more about how you're helping your clients kind of discover the options that are available to them, and helping them choose something that's a good fit and is also cost effective for them.
Yeah, definitely. So in just talking about, I guess, who I would have these conversations with, I know that you both serve a wide audience of people coming from business owners to solopreneurs to people who do have a traditional job. And those are the people that I'm having conversations with. It really is anyone, or the people who are like, knock on wood, I hope nothing happens. Everything's been fine for a couple months. I'll go without health insurance. Like, it really is just a conversation to educate and allow people to know that there is a difference. So I'll kind of go with, maybe start with like who might be considering this, and then how it is that we just have the conversation and see if we're really a good fit for them. So one of the groups of people that we help is business owners. I know business owners want to attract and keep top talent. In a way that you do that, you treat them fairly, right? You take care of them, and you think of, if I were in their shoes, what would I want? And the one thing that people mostly look for is healthcare. If I have
Mhm.
job A and B and everything is the same, but this one offers healthcare, I'm going to go with this one.
Right.
So we really do want to serve the business owner and saying, hey, you don't have to be at a certain place, even with how much revenue you're bringing in. We literally have a solution for you where you can actually incentivize your employees, and you can determine how much money you want to contribute per employee. So I've talked with business owners who are like, we're 2 years, 3 years out from offering this, but let me hear what you have to say. After a conversation with someone, he said, we can implement this next month. because it actually gives the business owner the discretion. Hey, you've been with me for 5 years. I'm going to pay for you 100%. You just started. We're going to go ahead and give 10%. I mean, really, it literally is up to them. So this is, I would say, the solution for business owners to be able to keep that talent. And, that's such a high expenses turnover, training new people, keeping that. Like, if you've got a good workforce and you've got a good team, that's like maybe more than half the battle for a business owner, which is just incredible. So I would say that's kind of one group of people. And pause me at any time if I say something you guys want to jump on it or whatever. I can keep going and going. So business owners is one of them for sure. And it's not, it doesn't matter. I know oftentimes business owners think I have to have 15 employees to get like a good rate, or I have to have this. Nope. You have 3 employees, you have 30 employees, it's going to be the same rate. So we're very transparent when it comes to that. We don't charge a business owner more than we would just a person who has a family and wants to cover them. So it's literally out of the box. Just a really quick example. We helped a business owner who is a home inspector, and he had 6 employees, and he had traditional insurance, which is great. We gave him a quote and we saved him. He had his 6 employees connect with the service that we offer, and they save $67,000 a year just in healthcare cost. So that's just to give you just an example, just a small company. I mean, 67,000, that's another employee or 2.
Yeah.
I mean, depending on what industry and, where you're located, like that may, or it's just increased revenue for the business.
So this is a good solution for your mom and pop businesses all the way up to your big businesses.
Yep.
Okay.
Yep.
Good to know.
Yep.
All right.
Most definitely. Yeah, for sure. So business owners are one group of people that we talk to. And then solopreneurs and entrepreneurs. I've been a solopreneur since I graduated from college, and have had to navigate. I haven't always been in this space, but I've had to navigate through the health benefits, just like my fellow entrepreneurs and solopreneurs. And so do we want to give that to ourselves? Do we not want to like have that expense? Do we want to put our family at risk? Do we want to risk incurring medical debt by not having it? Like, do I just get a catastrophic thing? Like, there's so many options. And what I'm talking about is truly comprehensive healthcare, like truly, truly comprehensive. So that is a great niche because it doesn't matter how much money you make. I don't know if you guys have talked to people who, say, okay, I'm going to get it through the marketplace and I think I'm going to make this much money, but their business does well. And they have a fine at the end of the year, $5,000, $10,000, $15,000 they didn't expect or plan for. Ours doesn't matter how much money you make. You could make $150,000 a month or a year, or you can make 50,000. The price is going to be the same. So there's peace of mind knowing, hey, the last 6 months of the year was super big. I'm not going to have a bill at the end of the year because I didn't project my income accurately, which is a gamble, right? I mean, you want that problem because your business is growing, but you don't want that fine at the end of the year. So that's another group of people. I mean, I was, like I said, I had a plan before, an insurance plan, and I saved over 50% with a much smaller deductible, with more options, not being restricted where I could go. So it's been incredible. So business owners, solopreneurs, and then there's people who either take a job that they don't want or feel trapped in a job that they don't want, and they don't know that there's options, or they just feel like there's just a lot being taken out of my paycheck, because there's, a decent amount being taken out of a paycheck, especially if you've got dependents on there and whatnot. I mean, it's even a bigger amount to the company, but that's not your concern. So even for those people, hey, what if I can get a bump in my paycheck and not even out of pocket? Like if I did this directly, I wouldn't even have to pay as much as being taken out of my paycheck. So it truly is another option to free people up. Like you're not stuck in a job just because you want the healthcare, or like maybe you're a W-2, you're traditional employee and you want to start a business, like there's just, you're like, I got to hold on to this. Well, you may not have to. So I would say those 3 buckets. I think that includes the whole, and then people who are like, knock on wood, I don't have any, like, I hope that it's okay. I don't think I can afford it. So I think we covered all the buckets. So yeah, that's who I'm really just looking to have conversations to say, hey, like, this is an option. You're not stuck and you don't have to pay $2,500 a month. The most expensive plan that I've seen somebody on, and it's for people who are in their maybe later 50s, early 60s, was $800 for a family. And that was like higher end because they had younger kids who could still be on their plan.
Mhm.
So I mean, that's like on the highest end, which is, yeah, that.
Well, that's really
Yeah.
good because I know a lot of people stay in they're unhappy in their position because of their health care. Because their health care is so good, they're terrified
Mm.
of leaving because I'm not gonna, it's a big expense. Healthcare on your own or going to another company that maybe doesn't have the same amount of, I mean, that becomes it could potentially come a pretty big bill. So that's great. I mean, at least it's worth a conversation. You know, if it doesn't work out, great, but at least it's an option to be able to have a conversation to get all of your facts together. Because I know there's older people that stay just because of the health insurance, you know, just the
Oh,
fear of leaving. Yeah.
yes. Yeah. I actually, one of my friends, parents, who is in their 60s and looking to retire, he said, I'm holding on. If I had healthcare, I would be able to retire, but
Mm.
I can't right now. And so it's just even that, like you're ready to move on with the next chapter of your life and you feel like you're held back. Yeah. People just
Yeah,
don't
you'd be
know.
surprised how many people in that age group feel that way. Like they're ready to go, but they're afraid of, the change in their healthcare going from, an employer plan, a private plan or whatever, and then going over to Medicare and doing all this other stuff. And then, there's a whole other thing about just the lack of education around Medicare and what it provides and all the additional parts and everything else. So,
Mhm.
so yeah, I've seen that quite a bit, and it's good to know that there's some other options out there so they don't have to feel, trapped.
Yeah, definitely. Definitely. That's the worst feeling. And then knowing that there is a solution out there, but you just didn't have access to it is like, oh, maybe it's better if you didn't know at the end. But yes, no, it's good for people to know. It is good for people to know for sure. Yeah.
One of
So
the
when,
questions, one of the
oh,
questions I had was, are you able to work with people in all kind of 50 states? Are there particular areas that, you specialize in helping people? How does that work for you?
Yeah, great question. So yes, we work with people all over the country, except people in 3 special states
Mhm.
that for their laws, they decided they have not wanted to work with us yet. Not just us, but other kind of out of the box solutions. So Washington State, Rhode Island, and New Jersey are 3 states that if you have your business address there or your residence there, we wouldn't be able to serve you. Hopefully, New Jersey is going to be added soon. There's talks of that, major talks, but for right now, we can serve people in all of the other surrounding states. But the neat thing I would say is, if I had mentioned briefly before, we're a nonprofit and like we're literally out to disrupt what's possible, and they want to put the autonomy, the choices into the hands of the people. They don't want to say, hey, you need to go to this doctor because they're closer or they're cheaper. We want you to go to the doctor that you have found or that you've been referred to you. We don't want you to have any limitations. So let's say you lived in the state of Texas, but there was a specialist in New Jersey,
Mhm.
you could actually go and see them still. So if you can go to any facility in the states, you just can't be a resident of those 3 states. And then we also serve our immigrant population. So if somebody has an ITIN number and an ID from like a government issued ID from the US or a couple of other countries, they can also have access to this too. So
mm.
they really want people
Nice.
to get the care that they need,
Mhm.
which is really incredible. Yeah.
Love
That's
that.
fantastic. That's fantastic because I know we had an employee here that was on a visa and getting that individual health insurance it was tough. It was really
Hmm.
tough. And we ended up losing him because we couldn't one afford. I mean, the insurance on him was as much as what he paid. And it was like,
Yes,
I can't help you. I'm so sorry. So yeah, that's amazing. That's amazing.
definitely. For sure.
So another question I thought, so What if you have a pre-existing condition? Is it better to stay with where you are, or is it okay to go ahead and have the conversation to see? I mean, how does that work?
Yeah, that's a great question. So our program is open to anyone. Like we never turn anyone away. Honestly, even the enrollment process is 15 minutes. You just, if you're honest, then you're okay. There's just a questionnaire about your background. We don't have to get medical records or anything like that. And it's not kind of like one size fits all. We would have to look at what situation you've got going on. So I've had friends that their condition was considered pre-existing with more traditional insurance. And when they told our nonprofit, what it is that they had, they said, no, you can come. And she actually had a procedure done maybe a little bit after she joined. And they said, no, this is not no, we're not considering this a pre-existing. So I wouldn't say it's all or nothing. One neat thing about this is people can use it as a secondary or like a supplemental if they've got a family. So let's say you've got a family of 5, everyone's in good health, but we've got one person who isn't. The price point is you pay for one person right on the plan, or if there's 2 people on the plan, or if there's 3 or more people, it's the same price. So a family of 3 is the same price as a family of 5. So if you've got 5 people and one person doesn't have that great of health, let's say they've got diabetes, and that's something that kind of impacts all of the systems, we're going to say you're going to want something a little bit more traditional, but you can use it as a secondary, and it's not going to be added because an added price to the family because it's 3 or more. So it's not an all or nothing when it comes to that. Someone could have had shoulder surgery and it's been 2 years. We have a 36-month clause for pre-existing conditions. So if they're like, I have no problems with my shoulder, and I know that if I incur an expense, I'm going to have to incur it. It's not going to be, a part of the program. They just have to know that they're willing to come in knowing that if something happens, they'd be responsible, but we would accept them. And after 36 months has passed from their last procedure or treatment, then it would be like if there's something happened with their shoulder, it would be considered a new event. So I wouldn't say, no, don't come if you've got something that you think. Let's take a look at how the doctors wrote it down too. If it looks like it's a chronic issue, if they wrote it down like it's something chronic, that's different than, hey, a one-time flare-up of something. So it's
That's
good
good
to
to
look
know
into.
too,
Mhm.
because I know a lot of people stay because it's like, well, I have this issue and no one's going to accept me. That may
Mhm.
not be true. So it's
Right.
worth a conversation.
Yes,
Definitely.
definitely. 100%. Yeah. But that was a great question about pre-existing. I would say that's probably the most common question that people have. Yeah, it's pre-existing.
So what's another question that you hear often that we're not thinking of for some reason right now?
Yeah. So cost is a big one. They're like, how much is this mystery? I don't know. You're cutting all these costs and disrupting stuff, but how much does it cost me? And the neat thing about this, I mean, the cost for youngsters, so people who are, young,
Sorry.
maybe, I don't know, about 18 years old or so.
She's almost 18, yes. Yeah.
I'm like, we have a demo here. So for people who are 18 years old, it starts as low as $73 a month for them. So that's as low as it starts. As we get a little bit older, it goes up about 130, 150 a month. It can start as low as that. And then for families who, well, I don't know. I know how old I am, so that one's an easy one for me. Let's just say I'm 41. So let's just say there was a family of 5 and the oldest person in the family was 41 years old. I'll give you the quote for that so you can kind of get like an idea about how much things would cost. But um, the neat thing is you'll be able to see when the price will go up. It stays about the same for about 5 years. And since our inception, we have not raise the prices yet at all. Like we have no talks of raising the prices. It only goes up based on the age of the oldest person in the family and how many people are in it, which is really incredible. So there's even transparency when it comes to that in terms of, hey, I know for the next 5 years, this is what my medical bills are going to be. And I don't have to worry about a 20% increase every single year or it going up based on my usage either. So that's just like really incredible. So let's just say it was a family of 5 and the oldest person was 41 years old. There's 4 different options. And so there's a little bit more I would want to say, I guess, before I say the price, but what comes with this is it's comprehensive healthcare. It's for sniffles. It's to, God forbid, somebody develop cancer, has a heart attack. I mean, it's literally everything. Everyone gets a wellness visit included. They get their lab work done yearly, before you even touch a deductible. Free telemedicine, which I know us busy people and people with kiddos love, because you don't want to go and sit for 3 hours just to get a simple prescription. I just used it recently. I got a little virus and they told me they wrote me a prescription. I went and got it to help with some of the symptoms. And I was able to talk to a doctor within less than 10 minutes, I would say, and had a quick convo with them and got that taken care of. So it's like you're getting access to kind of having a doctor in your pocket. And then you get to choose, right, which doctors that you want to go to. And if a doctor says this is deemed medically necessary, we don't need any other documentation or justification for that. We defer to the doctor as long as it's, according to the guidelines. If someone wants to go and have an elective surgery, that isn't necessary, it's within reason, but it's all outlined there. So all of that gets included. But so the lowest price a month is $433 a month. That's where it starts out as. And the neat thing about us is that it's a family deductible. So if dad and the family, I don't know, busted his knee and had surgery and met the deductible, it's met for the whole family for the entire year, which is really neat. And it's month to month, like you're not even in a contract. So, if somebody gets a job and it's outstanding and they want to switch to that, like not a problem, they can do that. Yeah, that's just really great too. I love that. I love that part. And then you can change your deductible every year if you wanted to. Hey, we know that we're going to expand our family and we're going to have a birth and we're going to have a big surgery or whatever. Even if you ate through your deductible, it doesn't matter. Like there's so much freedom in this. It's like a good relationship, like going from something that wasn't so good. So it is, oops, I just closed. Oh, I still see you guys. Okay. I'm like, did I turn this off? So the lowest amount a month would be $433 a month, and then the most expensive is $605. Now, this is a family of 3 or more. So if they expanded their family, that's what it would be for the next several years. And our deductibles start as low as $2,500 for a family deductible. No in or out of network. Like I went from $10,000 deductible before by myself in network, and I was in a car accident. I had physical therapy. I had chiropractic. None of it went towards it. And all of that would have gone towards my deductible here, but it's okay. Timing is everything. And then after that, it's, if you meet the deductible, then it's a 10/90 split. So the client or you would be responsible for 10% of any of the bills, but that stops at $5,000. And that's for the family. So it really is incredible. I've seen families who have like a $10,000 deductible in network, a $20,000 one out. Like this is max out of pocket for the year. So if you got that $2,500 deductible, it would be $7,500 in total for the entire family if, a lot of stuff were to happen.
And once you max out, then it's 100% paid.
100%. For the whenever you started, let's say you started June 1st, then that next year the clock would start over.
Wow.
Yeah.
That's amazing.
That's
worth a call. I mean, that is so worth a call. So worth a call.
Yeah. I was paying over $400 before for myself. And this is like a family plan and the deductible. So I'm like, oh my gosh, it's crazy.
That's what people do. I was thinking myself is I'm paying almost $400 for just myself. And I think deductible's like $8,500 or something crazy. Yep. So yeah.
Yep. So Amanda, it's worth a call.
Oh yeah. For sure.
Yeah. Yeah. And I don't even want to tell y'all what we're paying for a family of 4. I don't even want to tell you. It's crazy.
Wow.
Yeah, it's crazy. So
yeah, this is definitely something that it reminds me of other professionals that we work with. I work really closely with like property and casualty, auto insurance brokers. And it's amazing to me how many people don't know to like regularly shop their insurance and that they don't get points for loyalty. They have rates raised all the time and there's other options out there. So this very much reminds me of the clients that I send to those people and say, we could save you money just by having you, talk to someone, get some quotes, created and see that like you could get better, like the same coverage or better, but for less. And that's real money in your pocket that you then can use to put towards your goals or to help your business or whatever else.
100%.
Yeah, and
That is so good. Yes.
I'm adding you to my find money challenge because, you know, anybody that goes through my 30-day find money, it's going to be, okay, your task today is to reach out to Jen and let's see what kind of insurance you can get. So yeah, I mean,
I love it.
this is going to benefit both of us professionally and personally. So
Definitely.
Love it. I
yeah.
love it.
So we're going to get
take down.
Yes, that's right. So we're going
Yes.
to get all your information and we're going to post it in the description of this live. And so people can start reaching out to you.
I love it. I love it. If I could help one person,
I know.
I mean, it literally can like shift people's lives and how they go about stuff. I had a family of 5 who was paying, yeah, about $2,200 a month and was restricted to a network, and their son had something happen outside of the network and it wasn't even covered. And now they came to us and they're paying $600 a month. Like,
See, that's
it,
big. Yeah.
it's humongous. It's
Yeah.
humongous. Yeah, it's crazy.
And I think you're good with us because I can feel your passion because we are both in the space of serving. We want to make sure that people are utilizing their money the best way possible and planning for the future the best way possible. And health insurance is a big part of that. So you fit in this little we got us a girl threesome going here that's just
Yeah.
awesome, right?
Jennie, Amanda, and Jen.
There
Yes.
you go.
I love it.
Well, this
Oh,
is
sweet.
awesome. Is there anything you want to say in closing? Anything you want to add that you didn't get to add? You know, anything that you want to end on?
Yeah, I just want to say, hey, it's worth a shot. Like, not to, just to share with people so that they know. Like, don't think maybe you think you've got it good. Like Amanda, your example, I didn't know about shopping around my car insurance. I just like set it and forget it for
Mhm.
years. I don't know how much money I just saved this past year.
Yeah.
So it's just worth a shot to just like, hey, you don't have to be in a bad relationship with health insurance or be stuck or not think you can offer your employees or this or that. Like, it's just, yeah, it's worth taking a look at. It can
And
make
it
the
costs you
difference.
nothing to ask the questions
Yeah.
Nothing. Yeah. Yeah.
and could
Thank
save
you so
you.
much for having me on here. This was so delightful.
Oh
Thank you
yeah,
for
thank you so
being
much for coming on and sharing all this amazing info. I hope people that are watching this take advantage, reach out to Jen and you know, see how her plans compare to what you're doing now. And I bet you probably a bunch of money that she's going to come back with a much better deal than what you're doing now and save you some real money that you can use for other things. So we appreciate
Yeah.
you.
I love it. Thank you so much.
All right. Till next week, y'all.
Bye.